We have to start the story 18 years ago when we discovered that our son Dylan, who was having trouble speaking and making eye contact, had autism. And that's where our journey began. He's 20 years old today. And when he was 2, we had a lot of challenges, finding services, telling people, asking people what you would do with an autistic child. And those challenges have changed for us, and now he's out of high school, soon to be out of college, and going to be an adult. And so the challenges of how we integrate him into society, how we give him the best life we can, are part of why we're here and why we're supporting this initiative.
And when Dylan was young, he was part of the first wave of what people refer to as the autism epidemic. And again, as Nelson said, there wasn't a place to go, there wasn't a person that could help you orchestrate or figure out all the many therapies that he needed to do in order to have the best possible outcome. And since we're on that first wave, we found at every stage, we're on our own, we're figuring things out, we don't know what we're missing. And now as a young adult, these kids are they're walking off the cliff. Their services end at 21, and nobody knows how to get these kids the best possible life that they can have. And if there could be a place where people could go with their young adults and their transitioning autistic family members to have those questions answered for them in sort of a systematic way, it'd be wonderful.
There's so many programs all around the country that help with early intervention, and early intervention saved Dylan. It got him verbal, it helped him get coordinated, it helped him with so many things. We're looking for GW to really lead the way for these kids in the next stage of their life. Who's going to help them transition to adulthood? We want this to be the place that's known for the research that we do, for the policy that we help set, but more importantly for the people that we can help transition their autistic loved one to adulthood and into the real world. GW does some wonderful work in autism today. We have people in our Graduate School of Education and Public Health, scientists in our medical school, people in the Columbian College that are doing great work. And, but we want to bring them together. We want to give them leadership. We want to have them have a mission that can drive their study and drive their outreach into the community, drive their service. So we think that the time is ripe for GW to step out and be a leader in helping autistic adults enter the world. We funded a study almost 2 years ago now in the School of Public Health in this area, and it has some promising results, but there's a lot of work yet to be done.
We're making this gift to fund a director. We believe that the initiative really needs someone who can fundraise, who can bring the right people here, and who can really excite and ignite the passion of the people who are already here. GW already has a couple dozen people in various autism-related fields doing wonderful work, but we need more people, we need more money, and we need those people to really be spurned on by a leader to the next level.
This will be the Carbonell Family Professorship. We're endowing that chair. And the reason it's the Carbonell Family Professorship is because this has been something that has engaged our whole family. Michelle and I are the parents, but our daughters learned things about life and about people very early, and they had to tackle really difficult things, probably before they were ready. Our son Dylan still today has the challenges of being an autistic adult. So it made more sense to us to name this after our family, because it's our family that's gone on this journey, and it's our family that's hoping to support others in their journey.